Okay, Paul, you can take it away.
Okay. Well, good evening. Thank you, everybody, for joining us today. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID update for Wednesday, December 15th. As always, let's begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Paul Gullickson.
Thank you, Gilbert. So the big news for this week is the decision by the California health officials to reinstate a statewide indoor mask mandate due primarily to the rising number of COVID cases across the state of California. This statewide mandate took effect today and is due to last until January 15th of 2022, 30 days from now. That said, it's fair to say that the impacts on Sonoma County are fairly limited. And that's good news for us. The California Department of Health came out with a modification to the mask mandate, making it clear that this new order only applies to counties that do not already have indoor masking mandates in place, like Sonoma counties. So here's where we stand. For now, there will be no changes to the current masking policies in Sonoma County. This includes for those who are taking advantage of the amended health order issued in October, which allows some gyms, churches, employers, and other organizations to let stable cohorts of 100 or fewer people to be fully vaccinated, stable cohorts of 100 or fewer fully vaccinated individuals to go maskless indoors. That policy remains unchanged. And we'll talk more about that shortly. No doubt. Meanwhile, our pediatric vaccination campaign is continuing as we press to get as many of our children vaccinated as possible prior to school getting out on Friday for the holiday break. As of today, our 5 to 11-year-old population is about 30% partially vaccinated. We also are starting to see more children getting their second doses as well, giving them full protection. We're at about 1,000 children, or about 3% of our 37,000 5 to 11-year-olds have been fully vaccinated, which is great news. Overall, our total eligible population of 5 and older is now 75% fully vaccinated in our county, with another 9% having received at least one dose. And as we head into another holiday and with our case rate starting to creep back up, getting vaccinated is the most important thing you can do to keep yourself and the community safe. We encourage you to take advantage of that and get your boosters. And we'll be talking more about that as well. We still have not detected any cases of the Omicron variant in Sonoma County, but we are monitoring that situation closely, and we continue to perform genome sequencing on samples to determine which variants are circulating in our community. But so far, we are still addressing largely the Delta variant. As many people consider will be traveling over the holidays, our message is clear: to get vaccinated and continue to be tested. While required for some travelers, getting tested is just a safe precaution to take if you're going to be gathering with people over the holidays. It is important for all of us to know our COVID status. And even if you're not experiencing symptoms, you could still be carrying and spreading COVID to others around you. So testing is a good idea, whether you're vaccinated or not, and we encourage people to take advantage of the opportunities, as well as the over-the-counter kits that are now available at pharmacies everywhere for the rapid testing that's available. But for more on that, I'd like to turn to Dr. Sundari Mace, Sonoma County's health officer. Dr. Mace?
Great, thank you, Paul. So as we head into the holidays here, testing is a key part of our COVID response, since it does allow us to see where the virus is spreading. People are now becoming more familiar with the at-home rapid antigen test, which you can buy at your local pharmacy. Binax now is one example. While the rapid tests are not the most accurate, they can be helpful when you need fast results. They're also effective when used with one or more sensitive PCR tests. Ideally, if you know that you'll be traveling or gathering, you should take a PCR test 3 days before your event. and then a rapid test on the day of the event or travel to confirm your status. There are many county-supported PCR testing sites where you can get a free test, in addition to going through your primary healthcare provider. For a list of all county-supported testing sites and pop-up events, visit socoemergency.org/testing. Our case rate, which we saw level off this fall, is now starting to inch back up, likely as a result of holiday gatherings. Our overall case rate is 11.1 cases per day per 100,000 residents now, and our test positivity is up around 3%. Our hospitalization rate is also inching upwards. As of today, we do have 27 people in local hospitals with COVID. The main thing we want people to know is that while we're in a better place this year, this holiday season, than last year, thanks mostly to the vaccine, people are still getting sick from COVID and ending up in the hospital. We're not yet over this pandemic. We need to continue to practice the safe behavior that we're all used to. So over the holidays, wear a mask indoors, avoid gatherings whenever possible, and get tested. And we still have around 20% of our total population that hasn't had a single dose of the vaccine. So if we need to continue getting these first and second doses, as well as getting booster shots into arms. The booster is now available for those 16 and over who are eligible in terms of the time frame. And I highly recommend that if you haven't gotten a booster shot and you're eligible, you get one now. So for more on the vaccination campaign, I'm going to turn this over to Dr. Urmila Shende, our vaccine chief.
Thank you, Dr. Mace. So demand for vaccines continues to increase in Sonoma County, especially as more 5 to 11-year-olds get vaccinated and more people seek booster shots. We've now administered more than 860,000 vaccine doses in the county. Our 5 to 11-year-old population is 27% partially vaccinated, with another 3% who are fully vaccinated, as second pediatric dose clinics have only just started. Our school vaccine clinics, in partnership with Sonoma County Office of Education, have been very successful so far. This week will be the final week for school clinics until the new year, as they are going off on hiatus for the winter break. We will have a vaccine clinic tomorrow at Madrone Elementary School in Santa Rosa from 3 to 5:30 p.m. and clinics on Friday at Cali Calmecac Language Academy in Windsor from 2 to 5, and Abraham Lincoln School in Santa Rosa from 2:30 to 5:30 p.m. After that, we'll pick back up on January 3rd, 2022, with the clinic at El Verano School in Sonoma. During the break, families can still get their kids vaccinated through their primary care provider or their local pharmacy. Vaccines for kids are also available at the Roder Park LHI Clinic Tuesday through Saturday from 3 to 6 p.m. and the Roseland Community Center Clinic Tuesday through Saturday, 9 to 6 p.m. For those who've been fully vaccinated, please do get a booster shot, as Dr. Mace mentioned. The safest thing you can do with variants circulating in the community is to get fully vaccinated and boosted. Boosters are now available to anyone 16 and older, as long as it has been 6 months since they received their second dose of the Pfizer vaccine, if they're 16 or 17, or their dose of Moderna, if they're over the age of 18, or at least 2 months for people who received their J&J vaccine. Only the Pfizer vaccine has been approved for 16 and 17-year-olds. Boosters are especially critical for people over the age of 65 and people with chronic medical conditions. You can find information about the local vaccine clinics and how to make an appointment at socoemergency.org/vaccine. I look forward to answering your questions, but now I'll turn it over to Paul Gullickson, our communications manager.
Thank you, Dr. Shinde. We appreciate that. I now would like to go to Kate Pack, our lead epidemiologist. We've asked her to help provide us with an update and some slides. So Kate, you want to take it from here?
Thank you, Paul. Pull these slides up. Okay, as Dr. Mays mentioned, as of today, we have 11.1 new cases per 100,000 residents. And our test positivity, both overall in the county, as well as in the lowest quartile of the Healthy Places Index. Those are areas of the county where residents have less access to resources to support their health and well-being. In both overall county and in the lowest quartile of the HPI, we're seeing about 3% test positivity. 26 people are hospitalized with COVID-19 as of data reported by the hospitals yesterday. This is a slight increase over the levels that we've been seeing over the last month or so. And looking since July, when we first began seeing the Delta surge, 96 people have passed away from COVID-19 complications. Looking at our testing trends, we had a brief decline in testing over the Thanksgiving holiday, but demand for testing has returned to the levels that we saw before Thanksgiving. And we're currently conducting 583 tests per 100,000 residents per day. Looking at our case rate trends as compared to other Bay Area counties, you can see that Sonoma County, shown here in blue, has the third highest case rate in the Bay Area currently, behind Santa Cruz and Marin. Looking at the spread of COVID-19, currently in the Bay Area, the spread appears to be stable, so we don't appear to be seeing active increases based on data, the recent data. Looking at our case rates in 2021, shown here in red, as compared to our case rates in 2020, we continue to have lower levels of COVID-19 than we were seeing last year. However, with colder weather and the holiday season prompting more indoor activities and gathering, we may see increased transmission. And the degree to which we're likely to see a winter surge and how large that surge will be will depend on several factors, including vaccination rates, variant transmissibility, which we'll talk about more in a moment, as well as the effectiveness of boosters. I wanted to note that on our dashboard, if you look at the vaccine dashboard and go to the vaccine outcomes page, you can see regularly updated data that provides risk ratios. So how likely it is for unvaccinated people versus vaccinated people to become infected with COVID-19, to be hospitalized, or to die from COVID-19 complications. Looking at the population 5+, as of today, looking at the past 90 days, we can see that people who are unvaccinated are almost 4 times more likely to be infected with COVID-19, over 15 times more likely to be hospitalized for COVID-19. And looking at data since January of this year, we see that unvaccinated individuals are nearly 13 times more likely to die from COVID-19 related illnesses than are those who are fully vaccinated. And I wanted to speak briefly about the latest on the Omicron variant. The new variant has not yet been identified in Sonoma County. On our dashboard, we do track the numbers of variants that we are seeing in our county. Omicron is listed on that table now as a variant of concern, and that number is still at 0. However, Omicron has been found to be highly transmissible, and it's accounted for 3% of the cases sequenced by CDC this week, as compared to less than 1% in the week prior. And CDC has noted that they're anticipating seeing a large January Omicron and Delta case surges. While research is still underway about this variant, initial findings suggest that while this variant may be less severe, hospital capacity could still be impacted due to high rates of transmission. And initial research on both Pfizer and Moderna have shown that getting a booster can offer good protection against the Omicron variant, well, the initial 2-dose series may be insufficient to provide the level of protection that's adequate. Looking at our local vaccine administration, you can see, as Dr. Shende noted, that demand for the vaccine has increased both among 5 to 11-year-olds and individuals seeking booster shots. And so we're seeing levels of demand that we haven't seen since about March of this year. And 75% of the population 5+ is now fully vaccinated, while another 9% is partially vaccinated. Looking by age group, you can see, as was noted earlier in this briefing, that nearly 26% of 5 to 11-year-olds are now partially vaccinated and 4.4% are fully vaccinated. One question that I had received from a member of the public was why we aren't seeing this number of fully vaccinated 5 to 11-year-olds going up quicker, because they know many different children who've received their second dose. And I just wanted to add the reminder that the definition of being fully vaccinated is receiving those 2 doses, then also 14 days after that period. So as children receive their second dose and then 14 days pass, then they're added to this fully vaccinated total. Looking at proportions vaccinated by race ethnicity, we continue to see progress, but still note disparities in which our Hispanic, Latino population and our American Indian, Alaskan Native population and multiracial populations have a smaller proportion of residents vaccinated than do some of the other racial ethnic groups. Looking at booster dose administration, looking at one of the most high-risk groups for COVID complications, you can see that almost 68% of eligible 65+-year-olds in Sonoma County now have a booster dose, which, as we discussed, is important protection to have as the Omicron variant may become more common in the Bay Area as well as Sonoma County. Looking at our booster dose equity metrics, we can see that in the lowest quartile of the Healthy Places Index, where individuals have less access to resources to support their health and well-being, 62.2% of 65+-year-olds who are eligible have received their booster dose versus 71.4% of 65+-year-olds in the highest quartile with access to the most resources. And looking by race ethnicity, we can see that a smaller proportion of Latinx and Black African American residents, as well as Native Hawaiian and other Pacific Islander residents, have received their booster dose as compared to white non-Hispanic residents. And as was noted earlier, the state did issue a statewide indoor masking order that runs from today to January 15th of next year. So that's important to keep in mind as we discuss these metrics. But looking at our current status on the ABAHO metrics for lifting the indoor mask mandate, the first criteria is having CDC transmission rates of less than 50 cases per week per 100,000 population. Currently, we are above that level. We're at 62 cases per week. We would need to have transmission less than 50 cases per week for 21 consecutive days to meet this criteria. Low and stable hospitalizations is also not currently met at this time. As discussed earlier, we are seeing some increase in local COVID-19 hospitalizations. The third criteria can be met in 2 different ways. So the first way would be that looking at our total population, 0+, that 80% of that total population was fully vaccinated. Currently, we have not met that criteria. We're at 71.3% of the population 0+ fully vaccinated as of today. Another way to meet this third criteria would be to wait at least 8 weeks after 5 to 11-year-olds become vaccine eligible. And we've also not yet met that benchmark. We're at about 5.5 weeks since the initial approval. And that's the end of my slides.
Great, thank you, Kate. We always appreciate your efforts in producing those slides. So thank you for being here. And I'd like to go to our friend Casey D'Angelo from the Sonoma County Office of Education. Casey, we've talked briefly about the school clinics. Can you give us an update of how those are going and what your plans are going forward?
Certainly, Paul. Yeah, the clinics are going very well, as you heard from Dr. Shendy and Dr. Mays. We're at 30%, at least one dose. We have over 18 clinics planned for starting in January. And so we're looking forward to those. And some of those clinics, 2 of them are for high schools and 2 at middle schools, and the other 14 at elementary schools. We want to keep making sure that teenagers also have access to their vaccination, because we want to up those numbers as well. We've been focused on the pediatric, but we don't want to forget that we're not quite where we want to be with that age range. So there'll be quite a few opportunities starting in January for that. So we're looking forward to that.
That's great. It's good to know that we're going to pick right back up as soon as the holidays are over. Just to remind people, though, that clinics will be running through Friday, and you can find those venues by going to socoemergency.org or the SOCO website. We also encourage people to, there are other opportunities to get vaccines for your children or for yourselves, and you can get appointments at the myturn.ca.gov website. That's myturn.ca.gov, and appointments are available for vaccinations as well as boosters, as well as flu shots. We always encourage those as well. Well, we're going to end our session here. I want to thank all of our panelists once again for sharing this information today. I also like to thank the crew who make these webinars possible, and particularly Juan, our Spanish interpreter, and Elizabeth, our ASL interpreter. We will be streaming a recorded version of this briefing in Spanish on our Facebook page tomorrow. With that, we say good night, everybody. Stay safe and get your vaccine.